Welcome back to Business AM. In case you're just joining us, you're watching Metropole Television. My name is Simba Elijah Charles Kiage. On this Tuesday morning, let's introduce you to our sector trends this morning. Today, let's deviate a little bit and talk health business. And let's talk matters fertility with a focus on IVF, Introvitro Fertilisation. And this has been a rather complex health topic. We have a lead IVF specialist to take us through, and we are joined by Dr. Rajesh Chaudhary. Dr. Rajesh, good morning, sir.
Good morning.
Happy to have you around and welcome to Metropole Television.
Thank you.
All right. We're saying that this is a complex issue, the male or female infertility. Let's first address the complexity in that.
Yes.
Yes, Dr. Rajesh, can you get me?
Yeah, will you please repeat the question?
Yes. Well, we're saying that this is a complex issue. Why is male or female infertility a complex issue?
Yeah, as per the WHO, infertility is a disease of the male and female reproductive system.
Yes.
Defined by the failure to achieve a pregnancy after 12 months of regular, unprotected sexual intercourse.
Yes.
So infertility has affected millions of people around the world. It is estimated that 250 million of people has been affected by the infertility, either in couple or in individual. So the male infertility, it is when for example, it is caused by a problem in male when his inability to ejaculate insufficient number of sperm. And female infertility is caused by a problem in female when she is inability to produce egg, or when an egg is unable to travel to the womb, or any other example.
Fantastic. Dr. Rajesh, now for anybody listening to you this morning, I like that introduction, and you're saying that this is an issue that is affecting 250 million people worldwide. That's a huge number from where you're sitting this morning. What could be the leading causes as to why we have this huge number, 250 million people?
So the cause of the infertility as such, when it is either in the male or in the female or both in the couple,
yes,
approximately contributing 1/3 in each, like 30% in the reason could be in the male, 30%, 35% in the female, and the remaining 30-40% problem being both in the male and female.
Yes.
So in male, for example, the problem could be because of low count or low or absent of the sperm in the testis. The problem could be like there is an abnormal shape and motility of the sperm. That is the main cause. And the risk factor that can lead to this condition of absent or low sperm could be like abnormal vein, enlarged vein of the in the testis, or it could be in childhood infection or trauma in the testis, and abnormal like weight gain, this weight gain, and like risk behavior like taking anabolic steroids. These are all the risk factors that can lead to abnormal sperms or absent in the sperm.
Pretty much. What about the female side, Dr. Rajesh?
Yeah, female, the most common cause in female is the problem in the ovulation.
Yes.
So ovulatory problem is the leading cause. Apart from that, there can be a problem in the reproductive tract, like this fallopian tube, infection in the fallopian tube leading to the blockage, or there can be a problem in the uterus, like fibroid, endometriosis. These are the main cause of infertility in the female. Apart from that, these days many women they choose parenthood in late age, and then there is a decline in fertility with age, like the low number of egg in the ovary.
Pretty much. You're mentioning a very interesting point, which would have begged for me to ask you this question then, Dr. Rajesh, before we continue with this conversation. What is the right age for a woman to start parenthood?
Will you please repeat the question, please?
Yes, can you get me now?
Yeah.
Fantastic. What would be the right age for a woman to think about parenthood?
Yes, the best age biologically and scientifically is before 32 years, because it has
Yes.
been observed that after the age of 32, the quality and the number of egg in the ovary they starts declining, and after the age of 35, there is a sharp decline in the ovarian reserve. So 32 years is the best. Before 32 years is the best age.
Yes.
The age can imply to the men as well, because it is generally thought that men is not affected by the infertility, but it is not so. But the affection is a bit late in men. It's after the age of 45, there is a damage in the genetic component of the sperm. So even for men, it's best to have achieve the parenthood before the age of 45.
Pretty much. All right, Dr. Rajesh, can we therefore know about fertility point, what you guys are doing, and why you decided to come up with a fertility point before we continue with this conversation this morning?
Well, a fertility point is a part of the NMC, and it has assisted patients all over from the Africa.
Yes.
The center was established in Nairobi in 2018. NMC Hospital Group is the world's leading fertility provider and has the largest network of fertility centers around the world. I joined Fertility Point in December 2020. I was approached for the position in the mid 2020, around July, but because of the COVID situation and travel restriction, I couldn't join then, and I joined a bit late by 5-6 months.
Yes.
So, after knowing the background of the Fertility Point and its affiliation, I decided to be part of the Fertility Point. I'm proud of it.
Pretty much. Now, let's address the elephant in the room then, couples. And when it comes to deciding to start a family, would you advise that before any couple gets to start trying for a kid, that is actually important, therefore, to seek proper consultation before you can actually start trying out for a family, Dr. Rajesh?
You mean what investigation the couple has to go through before the treatment?
Yes.
Yeah, so first of all, when a couple comes for the treatment, infertility treatment or counseling, or when an individual
Yes,
comes
Dr. Rajesh,
for...
I'm sorry to cut you short. So the question was, before we even talk about the infertility treatment, the question was, when as a couple you decide to start a family, should you first go for a fertility consultation before even trying?
Yeah, when a couple has decided to have a baby,
Yes.
and after 1 year of regular intercourse without any contraception, if the woman is not conceiving,
Yes.
then they should consult a fertility specialist. This is before when the female is before the age of 35. If the age is more than 35, between 35 to 40, they should try for 6 months only. They should
Yes.
not give more than 6 months to themselves. If a woman is more than 40 years, then they should not give more than 3 months before after which they should consult a fertility specialist.
Pretty much. So what sort of treatment then would a couple go two when it comes to that sort of infertility treatment? What does the process entail?
The first process is the consultation with the fertility specialist, where the fertility specialist will have a detailed history of the couple regarding their regular this menstrual cycle and any other any previous surgeries. All those histories are sought, after which he will ask for certain fertility test.
Yes.
This test will be in men. The test is simple. It's just a semen analysis, and if the analysis says that the sperm count is good, then there is no any further test is required for men.
Yes.
Yeah, and if there is any decrease in the count or the motility, then maybe the fertility specialist will ask for some hormonal test and the escortal examination and ultrasound. That's all.
Yes.
Now in female, because of the complexity of the reproductive organ, there is a extensive blood test workup. So this workup includes blood test, mainly the hormonal test, and ultrasound, a basic ultrasound, and a test that will reveal whether the fallopian tube is open or not. So the idea of doing all these fertility tests is to know where does the couple stand, what is the fertility potential of the male and the female.
Yes.
So after knowing all this, as per the generally there are more than one problem in the couple. Maybe a problem in the uterus as well as a problem in the ovary, maybe problem in the ovary and the problem in the men as well. So as per the diagnosis, the treatment is advised. The treatment could be simply insemination process if the fallopian tube is open, if the uterus is normal, and there is a problem only in the mild problem in the men, then insemination can be advised to the couple. And the insemination is like during the time of ovulation, the husband semen is prepared in lab and the motile sperm is deposited, inseminated in the uterus directly. If there is a problem, severe defect in the husband sperm,
Yes.
or there is a problem in the fallopian tube, then in vitro fertilization or ICSI is advised, right? If there is a problem in the egg, say the woman age is more than 42 or 45 and there is no egg in the ovary, then we advise donor egg IVF.
Yes.
Where the egg of the younger donor is retrieved and that egg is injected with husband sperm and the resultant embryo is then transferred into the woman womb lining after
Yes.
preparing it.
Fantastic.
Yes,
Dr. Rajesh, just because of time, there's some direct questions here that I would like for you to respond to quickly as we come to the end of this conversation as well this morning. Now, this is a direct one. At what age is a man considered less fertile, Dr. Rajesh?
At what age, sorry?
Is a man considered to be less fertile?
Best fertile.
Yes.
Yeah. Before the age of 40.
Before the age of 40. That's when you're quite fertile, isn't it?
Yeah.
Fantastic. Number two, should you then cross into that infertility bracket? How does that man get help? That's the other question that we're getting.
Will you repeat it?
Yes. Should you find yourself less fertile as a man, how do you get help?
The men, how
Yes.
do they get help?
Yes.
Yeah, so in men, if the semen count is slightly lower than the WHO recommendation,
Yes.
Mainly we see three things: the count, what is the count of the sperm, what is the shape of the sperm, and what is the movement of the sperm. So if there is a slight deformities, then sperm boosting medicine can help.
Yes.
Right? Or the insemination, IUI can help. If the count is less than 5 million, or say 5 million, then generally we advise the men to go for the IVF. If there is no sperm at all in the ejaculation, then we do a detailed workup. We see whether there is a spermatogenesis, that is the sperm production in the testis or not. That we do by ultrasound and a certain test, a hormonal test.
Yes.
And then if there is an obstructive type of agiospermia, then we do a sperm retrieval directly from the testis and then do the IVF ICSI. Right? Sometimes there is no production of sperm in the testis. Then we advise for the donor sperm.
Yes. Fantastic. All right, now, Dr. Rajesh, finally, therefore, this morning, you're now back. You're working in a continent where there's a lot of misconceptions about fertility. Are you finding yourself really fighting a cultural issue, especially when it comes to fertility treatment problems?
Yeah, so what are the general myth about, you are asking about the myth of the infertility?
Yes.
Okay, so generally the myth in the society, it's related to the culture and the country. Here in Kenya, what I found the general myth is like this is a problem of the this is the problem of the woman. This is not my problem. I can't be infertile.
Yes.
That is I mean what most of the men they think. This has to be busted, because you know, the 40% of when a couple is infertile, then there is a 40% chance that men is the main reason for the infertility. This has to be busted out. In my practice here in Kenya, 90% of the time only women are visiting to the clinic. Men, they hardly visit.
Yes. Which actually shows exactly how deep that cultural issue then has gone deep. Now, you do know that's exactly the conversation that we have for you this morning. We have been speaking to Dr. Rajesh Chaudhary, who's a lead IVF specialist, and he ends that conversation with some very astounding numbers. 90% of those people who visit is a practice in Kenya are women. Now, just leaving just 10% to the men. And he's saying that, well, majority of the times, it's not just the problem of the woman. It is both of you that actually need to address this with an open mind. Dr. Rajesh, thank you very much for taking your time to speak to us here at Metropole Television.
Thank you for inviting me.
Anytime, and we take a short break. Once we come back, more sector trends.